Welcome back to another episode here on the Hart Hustle podcast with our guest, Mr. Michael in the house. What's up, Michael?
What's going on, Efrain?
What's up, man? Let's start off who you are, man. What is your role? What is your organization? What do you guys do?
It's a deep question. So I am the co-founder and CEO of Stella Mental Health, and we help people, I guess, suffering from depression, anxiety, PTSD, find relief from their worst symptoms. That's kind of the core of our mission.
And we got to get down to the why, man. I believe you didn't just wake up one day and say, this is what I want to do. Normally, I think when someone gets into a space like this, life experiences, maybe whether it's young, older, family, friend, how did it all come about, man? How did you get into this space?
Absolutely. Well, I'll start with I have no business being in this space, but you artfully said it. Sometimes life has uh, different twists and turns that are unexpected. So I guess I'm a career finance guy, uh, investment banking out of college and private equity here in Chicago for I don't know the better part of a decade. Um, and then the day after Thanksgiving in 2019, someone I had gotten to know died by suicide, and it was kind of my first personal, I guess, run in or yeah, I guess experience with mental health and I'd say the shock and the confusion surrounding it. Frankly, again, like I said, knew nothing about healthcare generally, knew nothing about behavioral health. But that person kind of started carrying the torch of that I'm going to tell you a bit about. Introduced me to Dr. Lipoff here, who's our chief medical officer and co-founder, who is doing just pretty incredible uh, pioneering work in PTSD and frankly helping to kind of alleviate the suicide problem in this nation.
Mhm.
Um, and after he kind of put us in touch and unfortunately is no longer with us, Dr. Lipoff and I kind of bonded over that experience and I'd say decided to try to make our own tiny little impact on the world. So that was, I'd say, the founding
This
story.
this friend that you speak of, was it in Chicago that it happened, or was this person
Yeah,
somewhere else?
Chicago.
Chicago. Oh no, man. I only asked because I can't remember the year, but I think it was almost around that time that it happened. The same thing after Thanksgiving, where I had a friend, and the only reason I say Chicago is because I remember he was from Chicago. So I'm like, maybe he wasn't in Chicago, but yeah, the gentleman, same thing. After Thanksgiving, committed suicide. I think wrote and also drove his car into the water after shooting himself or something along those lines. It was pretty kind of crazy to even think of because I was actually expecting him that we invited him over for Thanksgiving, understanding his situation X Y Z. Anyway,
Thank
it is
you to
very
hear that.
crazy how life works, man. In ways like that, and just to kind of see that there was people that loved him, right, enough to even create now this business and really to just kind of a legacy of him. And I think about just the mindset, how you mentioned the mindset, right, and people committing suicide. I've actually even heard another crazier story, well, not crazier, but crazy story as well, of a gentleman 41 years old that committed suicide, left his family behind, left a note that says, I couldn't come to terms with my demons or something like that. It's the mindset, right, man? And what have you said? You don't belong here, but you're in it. I can imagine because you're in it, you've learned so much as well from what did you learn when it comes to mental, when it comes to the
Yeah.
mind, the PTSD, and the way that we operate as humans?
As we're sharing those uh, tragic stories, what immediately comes to mind is, or what I've learned, um, is to shift that word commit suicide to die by suicide. Um,
Mm-hmm.
and I'll share why. Committing has a voluntary feeling to it, like you're making a choice. Um,
Mm-hmm.
and I think what I've learned, um, and by no means am I a clinician, am I an expert, but these circumstances people find themselves in are often imposed upon them involuntarily. trauma, life experiences, childhood
Mm-hmm.
events, war. I'll stop. I'll stop the list,
Yeah.
as you can appreciate. And people feel hopeless and trapped, and it is not necessarily a seemingly voluntary act. Um, it's just the only way to stop the
Yeah.
pain. So it's been this weird. I don't know why I'm fixated on this specifically, but it's been this weird thing I've had to train myself to not say committed suicide, but die by suicide. And our chief psychology officer has kind of helped ingrain that vernacular. But I know it's one word, but I think it's an important mindset shift that oftentimes
I-
we don't have control of
Yeah.
our circumstances, and you got to do what you got to do to make yourself feel right.
I can respect that too. I mean, you just changing that one word because it definitely does make a difference on the commitment versus the dying by understanding. As you mentioned, these are things people have been dealing with for a very long time. Sometimes goes unseen, or someone doesn't bring it up. They just, for whatever reason, that may look like. So, and myself, right? I think I told you this. I was pretty open when I talked about the sexual abuse that I've encountered for years in my life, and really the feeling alone in my life and all these things that I brought into my relationship when I first started with my now wife. And thank God for her. You know what I mean? Thank God for a strong woman. And I would never forget what she said to me, Michael. And she said, even if we don't work out, I just want to help you heal. I just want to help you overcome. And like, what strong words. And I didn't even know what that meant at that level yet. I'm still early 20s. But as I go through this relationship, also realizing some of the anger issues. I mean, punching holes in walls. I mean, just like in her face at times. Understanding that's not who I was, right? We kind of go back to just the mind, the experiences that we've encountered. And I would never forget when she says, I just get so scared when you get that mad. And I'm like, what do you mean? And she's like, I just don't know if you're going to, obviously strike me or something. I'm like, I would never. And she's like, I can't tell because when you get mad, you become this different person. And knowing that, Michael, I'm like, that's not who I am. That's not who I wanted to be. And realizing that I was just sweeping all this pain, all these things that were happening to me that I just thought was like whatever about it. I was sweeping them under the rug. And when moments came up or when she would ask questions, and at this point I haven't even talked about sexual abuse yet. And I think the more that I started really to talk about it, and really, I think I mentioned to you at 30 years old, even seek therapy on some other levels for some other things of just life, realizing that it was the mind. And I'm so fascinated when someone says the mind, because I think that we don't give enough attention to that. The same way that we want our bodies to look amazing and we want to be in the best shape of our lives, I think being in the best shape of your life is you really working on the mental health of things.
Yeah,
Yeah, going to the gym could help with that, but I think there's also digging deep into it. You being in this space, man, are you now more of an advocate? Like, I guess before this, were you an advocate of the therapy, of the mental health? Yes or no?
great question. By the way, thank you for sharing that, and we'll circle back to that. But the massive irony is absolutely not. I am an immigrant from Moscow, Russia. I think maybe culturally it's always rub some dirt on it. You don't show weakness. You don't whatever psychological things. I'll never understand how culture ingrains itself. No, I did not think about. If I'm honest with myself, I was probably
Mhm.
one of the people that didn't truly believe. Like, what do you
Mhm.
mean? Just suck it up, or change how your attitude, or change your perspective. And looking back on that, that's almost embarrassing to say.
Yeah.
Um, but maybe that's kind of the that's what
It goes back to, though, Michael, we don't know what we don't know, right? We were oblivious to it. We were naive, whatever the word you want to say to it. We got something happening in your life. You got to get more educated on it. Where's your stance now?
well, treating 10,000 people a month at this point, I think it goes without saying that that was a very naive and almost idiotic view I held. But to your point, and I haven't even thanked you for having me on, but ev- sharing sharing these conversations, I think, helps educate one more person, one more person, one more person, such that me 6 years ago could have been educated instead of needing some sort of event to force me into the education.
Hmm.
And I think it starts with us kind of having the conversations, and also I'll keep caveating, I am not a clinician. Don't have a crystal ball. I only know what I know over the last 5 years. But our kind of understanding and brand positioning in our clinical team, I think fundamentally believes that we don't really understand the brain. The brain is an organ to a certain extent, and
Hmm.
it can be treated with physiological or biological methods. In the same way, if you break your arm, you can take an X-ray and you know where it's broken, you know what to do about it. Maybe we're just not far enough along or to understand the brain that way. But I think to your question around what have I learned and how has my perspective evolved, it's gone from mental health isn't a thing, it's something you can control, figure it out, to the brain is no different than a bone. You break your bone, you're not going to walk on a broken leg, you got to heal it. Very,
Yeah.
very similar kind of, let's say, biological and underpinning to the way we treat people. And now that's not to say that everything needs a pill or an injection or this or that. Uh, Therapy is an intervention.
Hmm.
And anyway, I'm kind of rambling, and I don't want
No, no, it's good. I'm here also just thinking about this. These different stories. When people do not seek that help, I've actually experienced it in my own household with my mother-in-law. I've never had an issue with my mother-in-law, and she probably hates that I'm going to say this, but
hey,
she'll forgive me.
we're
She'll forgive me.
there you go.
But no, man, she had her own experiences as as a woman and in her own life, and I guess that also where she didn't get it fixed or didn't seek that help, that now she's seeing her grandchild in the relationship that may have and may probably thought that I was probably going to do something inappropriate to my daughter, right? And it bothered me more than anything, Michael, because when I tell you that I've worked on myself and who I am, I'm not here to repeat cycles. I'm here to break cycles. And I think she knows that, right? And has for the last so many years of my life. But whatever, because of one of her traumas, it allowed her to react in a different way. And I wasn't having it, to be quite frank, because understanding where I was at as a person. And she apologized and told me about, some of the issues that she was encountering and why. But it just goes to prove that people think that they can just sweep it under the rug, and they can't, right? It comes back to you at some point. And we talked about a little earlier, or I mentioned it. It could be a smell that brings you back to that moment of hurt, of being broken. And it's so when we talk about a therapist, it's not that just one and done. Sometimes it's having you can go through those moments. It is seeking that help, And one of the coolest things that we talked about, and I think we both agree on that. Yeah, there is the medication part to it, but it doesn't always have to take that. And I think that's where you guys kind of play the special part as well, Michael. If we can kind of talk about that, I think you guys are in a space that, yeah, you respect that there's medication there, but not everyone has to go through that, and it's not for everybody. That's not the go-to, the model that you guys are kind of going up against.
Yeah, no, absolutely. Let me put a pin in that last conversation, and then we'll talk about maybe treatments. So the other thing I think I learned, and it's hard to ingest, and maybe I still don't quite believe it in my bones, but is that everyone's experience is unique to them, and what is a massive trauma to one person, you don't trauma compare, you don't symptom compare, you just be supportive. So
Mhm.
um, obviously you shared your experience as a child. That is an acute event, multiple events. Obviously, veterans experience things in active
Mhm.
military. Those things are undoubtedly more severe than someone suffering just generalized anxiety for no specific event driven reason. but we don't need to compare one to the other. Everyone's experience and feelings are valid, and that's been frankly, I'd say hard to ingest. But how do you compare the person that was a war fighter and experienced what they experienced to, again, someone that can't even necessarily name some event that changed their life? The answer is don't compare them. So I think that's the other kind of learning here. Your mother-in-law had her experiences. I've had my experiences. You've had your experiences, and we don't need to. We don't need to invalidate how we're feeling because someone else, in our perception, may have had it worse. So maybe that's the only other thing I'd say, or kind of like foundational learning over the last 5 years, is that biological underpinnings and everyone's experience is their own, and they're 100% valid. So now to answer your question, maybe the good news is there is a lot of innovation happening in the space. So let me ramble a little bit about what we do and frankly what just the industry is kind of experiencing. So as we've maybe better understood, still don't fully understand the mind, but better understood the mind, there are interventions, and there's kind of a segment of psychiatry being called interventional psychiatry, which can lead to breakthrough kind of events in someone's processing ability of what they're feeling and just general symptom relief that doesn't require hours and hours and hours and hours of therapy or perpetual kind of medication. Far be it from me to understand how those things work, but there are a lot of innovations, frankly, not done by us. Our job is to distribute and deliver those treatments to patients, but there's a lot of innovation in kind of the market that is bringing things to people that otherwise maybe they would never find relief. So to your question, what do we offer? So at Stella, we offer general psychiatry, so therapy and medication management, which, by the way, absolutely have a critical role, both as frontline treatments, as maintenance treatments, as everything in between. And also, it's well known and studied that 2/3 of people are treatment resistant. Kind of, let's say, insurance company nomenclature, where they don't respond to those treatments. That's when we will offer also interventional psychiatry, which are in clinic kind of treatments such as transcranial magnetic stimulation, so TMS, FDA approved, insurance reimbursed, Spravato, which is a kind of nasal ketamine derivative, FDA approved, insurance reimbursed, both indicated for depression, anxiety, OCD in some cases, and also things like IV or IM ketamine infusions, as well as the Stellate Ganglion block for PTSD, which is kind of a lesser known procedure. But point being, there are these in-clinic modalities that can help, maybe wrong word, modulate the brain. Whatever happens in the body happens, and it allows people a breakthrough, a feeling window. I shouldn't mention they're right around 70 to 80% effective, so not everyone responds, but the great majority, and certainly more than just therapy or just meds, get this window to, as we get hundreds and hundreds of these kind of anecdotes, notes, reviews, feel normal again. And that opens up time to work on therapy, to work on your relationship with your significant other, to work on being with your kids, to get physically fit, whatever it is that that the brain or the mood may be prohibiting you from doing. Again, those kind of interventions can help speed up that process and do it in a way that doesn't always, or even most of the time, require reliving the experience. So they're just, let's call them almost biological uh, ways to feel better. So
If the Heart and Hustle podcast has ever sparked any idea or made you think differently, do us a favor. Make sure to guys share this, post it on LinkedIn, or even text that nonprofit friend that you just have. Whatever works, this is what keeps the conversation going and allows us to just grow this community together. Seriously, we appreciate you.
let me
I
wrap
love
it
how
up
you
too.
I love how you said that you started this not even so long ago, but you have so much you're informative on the space, right? Actually, I always joke with people like when people say you probably would say you're not an expert. In your case, you probably say I'm not an expert, but for someone that doesn't know the space, you seem like an expert to me, right? Like that's just what it looks like.
Well,
So it's like, but you do have a
that's a
lot of
dangerous
information
game.
because you're living it.
Again, the experts are the clinicians, but I know
Okay,
nothing's
okay.
dangerous, and the ability to, I think what I am good at is looking at data and numbers and being unbiased in ingesting and understanding objective facts. We collect outcomes, so patient-reported outcomes. There are clinical scales, PHQ-9 for depression, GAD for anxiety, PCL for PTSD, and others. We collect those before, during, and after treatment for thousands and thousands of patients. I just look at the numbers, and you can create care paths that are just meaningfully more effective in helping people get relief than the traditional ones. And also, it pisses me off that it's not 100% because I think once you understand the root cause of the symptoms, which is frankly all we're patching up in a lot of ways,
Yeah.
I think that's when you can get to 100%. Is are 99% of broken arms healed? I don't know, but I would guess maybe even more than that. So again, as a field, it's gone from maybe sub half the people getting to remission or way less than that to now edging above half and heading
Okay.
towards uh, in the right direction.
And is that global or is that just within the your organization?
Um, I would no global. To a certain extent, there's nothing special about us. I think we got going early, so we've got maybe more clinics and more ability to impact more people than most practices. But I
How
would
many
say
clinics do you guys
we've
have?
got amazing clinicians, but I'm sure there are psychiatrists here in Chicago that are doing equally great work. So and I view that in a very positive way. There will be maybe in
Yeah.
30 years we can all worry about competition and fighting over patients. Right now it's very collaborative because I think
Yeah.
as a field, as a practice, like clinicians want to do good. That's they get
Mm-hmm.
into medicine to help people, and sitting
Correct.
across the table from someone I would never know and hitting a ceiling and not being able to help them and seeing them again in the next therapy session and then again and then again and by the 40th one just as a human you're like what can I do like this is I so anyway point being I'm not answering the question but I think um, we've gotten a lot of amazing clinicians. Other practices have a lot of amazing clinicians, and I think
Mm-hmm.
the default position is everyone wants to do good. Now, to your point around, um, is it a global thing? The uh, the only thing that's stopping me from saying yes to that is awareness. And you said it exactly right. To you, I sound like an expert. I'm an idiot. I don't know anything. I'm just I'm just sharing information uh, collected over some experiences. So if you go out
Yeah.
and walk around Orlando and you ask 100 people, have you ever heard about therapy? 99.5 of them would say yes. Have you heard about medications, antidepressants, SSRIs? 99 would say yes. Have you heard about Spravato? Have you heard about TMS? 1 in 100 would probably say yes. So I think right now it's
Yeah.
an education challenge or opportunity where these interventions become not only known but almost like frontline. Right now we're kind of let's say forced to to take people through frontline treatments,
Yeah.
therapy, and SSRIs that can take a lot of time before we prescribe them the thing that oftentimes we know is going to work best, which is a second line treatment. And I'm sure there's really good, responsible kind of innovation behind that. But I can't wait for the day. Hopefully it's tomorrow, but it'll probably be a decade where you walk around Orlando, you ask them about these treatments, and 99% of them will at least have heard of these things. And that's when I'll answer yes to your question around
Yeah.
is it
Yeah. That
global?
makes sense.
Yeah,
I would say earlier you said if one person learns something that we're in a good place. So I want to let you know that when you start naming all these acronyms that I'm learning today, that there's even these acronyms that exist in this world today. So see, somebody's learning. If
there
it's
you
me
go.
or somebody watching, okay? I just want you to know, Michael, someone's learning. When you mentioned the clinics, how many clinics do you guys have right now?
So we have 12 clinics and about 100 or so practitioners.
Wow, all in the Chicago area? Is this
Southern California, Salt Lake City, Chicago, and Boston.
wow. You would have thought this was going to happen, man, when you decided to get into this space that you guys are now touching different places?
So many twists and turns. I have no business being here. Like I started this. Every day I'm like, what am I doing? And also I would say, despite it often being challenging, you're an entrepreneur yourself. Um, when you really sit back and frankly have conversations like this, you can ingest what we've done, and frankly,
Yeah.
um,
I
we're
think
we're
I
no
think
more
sometimes
close
when
to
you're
where we
in
want
it,
to be.
yeah, I think sometimes when you're in it as well, you can't really see it as sometimes. But from somebody from the outside and know how long it's been, and you already expanded and scaled the way. But I think also very strategic. You guys are not just scaling for the sake of scaling either. Is that correct?
Yeah, no, I think again, this is these are all learnings in the moment, but scaling for the sake of
Yeah.
scaling is a fast way, I would say, to not be around for a long time.
Yep.
So I think we try to think through the business through the patient lens. If we're
Hmm.
providing good outcomes to people, that person is going to tell someone, and that person may come see us when and if they need our support. So to your point, scaling is important, but frankly, you could do a lot of good in the massive markets and cities that we're in, and scaling can often have tension with quality. So especially in healthcare, there's you can't cut corners. These are people's
Yeah.
lives, so um,
Especially in the healthcare business. Especially in the healthcare business.
of course,
Today I was talking to a friend and we were talking about entrepreneurship and just how it's fun. It is fun. It's challenging. Easy to say fun when you're having a good time, things are going good. However, it can be challenging, a little stressful. We talked about anxiety, all that happens when we're kind of in that roller coaster. It's a roller coaster, as I like to say. Entrepreneurship, life is a roller coaster. There's ups and downs. And when you're down, you really got to stand strong. But it seems, as I spoke to one of your colleagues earlier, that the culture that you guys have within the organization is like you either with us or against us, right? And not so much against us, but you for us or not for us. You have to have a certain mentality. You have to bring a certain energy. I love when I spoke to her, you could just tell how highly she spoke of you because of the culture that you guys are being able to build. How important is culture while scaling?
yeah, such a great question. Again, 5 years ago, having never had an entrepreneurial experience, I wouldn't even know how to answer your question. I don't know what culture means. And sitting here today, it it really is everything. And if you don't take care, well, first of ourselves,
Hmm.
then of our employees, the people receiving services are going to feel that, and everything kind of ripples from the people delivering the care, especially in a service oriented business. I can't speak to product oriented businesses. I don't know, people order stuff on Amazon, that's what they care about. But when our clinicians are seeing patients all day, every day, creating care plans, um, they're not feeling right, if the support staff, which is as critical as the clinicians, aren't feeling right, um, that absolutely is gonna impede the service we deliver, and by proxy, kind of not help one person find relief. So it's a long-winded way, and again, I kind of shared. I'm finance oriented. I'm objective oriented. I'm analytical. So this like fluffy stuff is uncomfortable to me. But with every day, I better understand that um, like vibes are important, and I don't know how to quantify that. I don't even know how to
Yeah.
measure that. I don't know how to deliver that other than just kind of be genuine. Hire people for mission oriented reasons. Remember, especially in our business, and this is less a business and more, again, a mission. This is a vehicle to
Hmm.
deliver healing. And if we don't believe that,
I love
and
that.
then it all kind of like crumbles, I'd say. And frankly, there is some,
All right.
like, it's a hard industry. It's behavioral health. We're fighting stigmas. We're fighting payers not paying and insurance reimbursement and everything being new. So there's easier ways to, let's say, make a paycheck. So people, our employees, our team vote with uh, with their employment status with us, and um, if we don't have the people, we literally have nothing. So too many words to say. Culture is everything, and I don't know how to quantify it, which makes me uncomfortable. But I guess I just got to live with that.
I love this. I love to talk entrepreneurship. So I'm gonna give you another entrepreneurship question. I know you said 5 years ago you got kind of started to really kind of get into the space more. What are three things you think you've learned being an entrepreneur
Oof,
that you didn't know about entrepreneurship?
that is a deep one. I'll kind of piggyback off of what I just said. That it's in some ways the work is the easy part. It's like keeping your sanity, because it is hard. Like creating something out of nothing, I have found it incredibly challenging, and
Hmm.
challenging and not so far as, again, the actual work. It's it's moderating my own, and kind of our team's ability
Yeah.
to pursue the mission. So there's been a lot of unintended or unexpected internal work. Um, to your point, I kind of got into entrepreneurship with no experience, and it feeling like this romantic thought that uh, being an entrepreneur, like you fight the good fight. Yeah, it's hard as hell, and uh, many days you want to quit. So it's
Yeah.
too many words to answer your good question. What have I learned? Like it's just about doing one more day. Like that is that is it.
I love how you say this, right? And for some, they think, but wait, you have the clinicians, you have the, the clinics, like, but seeing it from a different perspective, realizing like that's a lot of lives you got to also like those are lives in your hands ideally, right? Anything happens at that level, everybody else starts to feel that at down beneath, if you have to close clinics, that hurts families. If you have to let go clinicians, that hurts families. So all that pressure I can imagine also is a lot. And as an entrepreneur, there's so many also hats that we have to wear at times. And of course, we start to build the team to allow us to, I guess, innovate and grow from where we're at. And I actually even ask you, man, we're in a space right now. I think you're pretty with the times, man. AI. Are you utilizing AI in this space? I know some people, which is respect that AI will never replace the human body, and we're not saying in that sense. We're saying in the back ends and automating and doing repetitive tasks. Are you guys utilizing that kind of technology?
Yeah, that is a tremendous question. So to your point around building the team, luckily we have a CTO. Otherwise, we'd be doing everything with paper and pencil. But let me try to coherently answer your question. So let's say there's both external AI use cases and internal, if or at least that's the
Okay.
way that my brain breaks it up. So we
Yeah.
provide a healthcare service. I think we have a responsibility to innovate, but innovate responsibly. Um,
Correct.
so one place we are not currently using AI is here's a chat bot that'll get to know you and that'll be your therapist. By the way, in 5 years, could that very well be daily life? Sure, but it's not our place to innovate in a patient's
Hmm.
care without evidence based, um, I'd say, research that our clinical team buys into. So, long winded way of saying we are not actively using AI to treat patients. But
Okay.
internally, of course, we're adopting as quickly as we can. So in healthcare, and tell me when these examples are or this is no longer interesting to you, but billing and collections is a massive thing I underestimated as really the engine of the business, meaning
Yep.
dealing with the
I've heard
insurance
that.
company. Like previous to this, like you go get your physical or whatever, you take your kids to the doctor, you don't know what happens. You flash your Blue Cross card and you don't worry about it. Behind the
Yep.
scenes, there are intricate processes by which a practice, I'd say often fights with insurance to get paid. And that can be hyper manual, hyper expensive, and a leaky bucket of money you deserve that you never get because you don't have the processes to collect it. So too many words to say we
Mhm.
are heavily investing in that function to I'd say break the linearity of
Yeah.
hire a person every time you want to open another clinic and you might wake up with 500 people in a billing team which is difficult to manage where technology can make at least that process a lot more streamlined, which by the way on the other
Yeah.
side is the payer, the insurance company. They've adopted this a long time ago. So when we're submitting claims, they're bouncing back because AI agents are finding some clerical error and making it difficult on us. So in short, it's almost like bringing, I wouldn't even say a knife to a gunfight. Like we need to arm ourselves with the ability to get paid fairly what we deserve. So billing and
I'll tell you
coding
what.
is a huge one that is
I've never been in the healthcare industry at all, but because I got friends that are in the healthcare, one thing that I always hear is billing and coding. And if you don't have someone that's good at it, right? Like I've had a friend go in there and she says, "Man, I made this company so much money all because I got on the phone and asked for the money, right? I had to. It was like pulling teeth, ideally, but we had to go get it. So to what you're saying, if you can automate that, man, or systemize that, however that may look like, so it becomes a little easier. You got more, now. You got people that are more excited to do the things that they love, which is cool. And that's what I think about AI. I don't think about a replacement, but allowing people to really do more of the things that they actually love, and kind of automate the things that we don't love, that
yeah.
are
No,
repetitive, that
to your
drives
point,
us.
I and I'm not a technologist by any means. I don't think AI is replacing people. It's certainly not in our business. It's making them massively more efficient. So such that last year we had 3 clinics. Today we have 12. Uh, Next year we'll have 30. We don't need to hire again
Yeah.
linearly in order to support that growth. The team we have today can just get 3, 5, 10 times more efficient and
Hmm.
eliminate the hyper manual tasks. It's like the equivalent of sending an email instead of writing a letter. Like, I don't know, that put a lot of people out of a job. No, it just like made us all faster at communicating
Yeah.
and it kind of just elevates all of our standards such that our focus
Yep.
is not how can we better fight with the insurance company to get paid. Like that's the critical back office. Like our focus should be 99%. How do we get more
The people.
people better?
Hmm.
That should be the conversation.
Hmm.
Not we have a liquidity issue because Blue Cross isn't paying us because our claims are going in wrong, and that prohibits the ability to open up the next and the 10th next clinic.
Yeah.
So you kind of need to
I
build
love
that
that.
into.
No, I hear you, man. I definitely, people get into the business to help and heal. And then when you got them doing other things, it becomes like, what is my why? And then you start to sit here like, am I really doing what I love? But it all happens that I'm happy that you guys are in the space of how do we fix this so we can do more of helping people open up more clinics to continue to help people. I love it, man. This has been a really good conversation, Michael. I love that. And for those that don't know, Mike mentioned he was even a little under the weather. I couldn't tell, man, because we were 40 minutes in having a hell of a conversation about just mental health, business, leaders. And I love that life happens for reasons and that you got into this space and that you've been able to spend some time with me from a person that's not as you mentioned, the expert, that I get to see a different set of eyes and how you come at it from that perspective, right? Because it's easy to someone that's been kind of doing this and this is their kind of bread and butter, but you've, for the last 5 years, invested yourself into this, invested into just learning more about it and helping people, that you can really now speak to it. As much as you'd say that you're not an expert, man, you're 5 years in, man. I'm pretty sure you spend the 10,000 hours. Is that what they say? You got to spend 10,000 hours or something like that, man?
I
You probably did that the first year, man, trying to just build this business that you had.
think that guy just made that number of Gladwell to sell more
Just
books, but yeah, something like that. No, and listen, vice versa. I'd say without people like you, A, sharing your story, and B, having a platform that other people can learn from. Again, we need each other. Everyone plays a role. I'll or we'll do our
I
best to
agree.
kind of treat people, but without people knowing that there are opportunities out there to feel better. Um,
Hmm.
and right, it's a very domino effect type of system. If you're not feeling right, your kids aren't feeling right, and like I love what you said. I'm not
Yep.
here to continue cycles. I'm here to break them. Like, yes, someone's got to break a cycle, and that takes
Hmm.
education, and you provide a platform for education. So, thank you.
I appreciate it. Yeah, I appreciate you taking that time. I think it does. It's one if one person, all right, it's how I look at it. If you can help one person, you left the world a better place than how you've entered. So I try to help that one person. I understand that through telling my story, I can help somebody as well, and through having others tell their stories or just stories of others, that we allow others to realize that they're not in this alone. That we all have some sort of baggage that we come with, and that it's okay to ask for help, that there's people willing at no judgment. And I think for a very long time, especially growing up in the 90s, for at least me, I think you're in the kind of the same space, Michael, where we didn't have that conversation. My household wasn't talking about mental health. You know what I mean? It
Yeah.
was, as you kind of said it earlier, just suck it up. You keep it moving. You didn't talk about your personal stuff that was happening at home, and things like that. And it's even sad enough to recently happened. My sister mentioned how my niece said she was maybe having anxiety or something like that. And my sister response was, "What are you even talking about? You don't even know what that is." Right? Instead of really having that conversation. This is the perfect time to educate. So I think sometimes even being very mindful of, yes, just educate, ask the questions. Don't let people feel bad about it. I was recently, the same name that I mentioned to you, I remember when he mentioned something along the of therapy, right? And I went home and I was like, man, I don't want him to feel like I was just kind of not wanting to have the conversation around therapy, because it's a conversation that you kind of got to be a little bit bold to have at time, at least nowadays. And when he said it, I had to go back to him and says, "Hey, man, I just want to let you know that I did not miss the part about therapy, and I'm an advocate for it. And if you feel like you got to go, then go for it." And that's how we kind of got into the conversation. So there's people that are watching. If you guys are watching right now, if you guys are asking yourselves, should I? Yeah, why not? It doesn't hurt. Also, I love to add to it, because I've seen multiple versions of it, is that your first therapist is not your last either. To me, it's like dating. You got to find the one that works for you. And it looks like, well, Michael, what you guys are doing is really getting that right fit, getting people that work with XYZs, with these type of backstories or traumas, or you talk about analytics numbers. Can imagine the data also has to do with that. I won't get into. I love numbers, but not in the way that you love numbers. All right, you ask me a math question, I'm there. Other than that, don't ask me about data.
Fair enough. No,
But Michael, we thank
just
you.
to underscore and then I'll shut up. Exactly what you just said is more people than not are going through something.
Yeah.
Not the like cliche "you're not alone" thing, but like it's everywhere. Uh,
Hmm.
it's more common than not. So there's not weakness in
Yeah.
talking to someone about it, be it therapy, be it whatever. I don't know. Start by working out. Start by
Hmm.
doing yoga. Start whatever. however someone needs to get on the on ramp to being the opposite of me 5 years ago, which is not even believing or thinking or knowing that this mental health was a thing. Like, treat it the same way you would treat physical health. There are gyms everywhere. Think of a therapist like a gym.
Yep. I agree, man. Thank you so much for your time, Michael. I appreciate your time. For if you guys want to know where you guys can find Michael and more about the organization, where can they find you, Michael?
StellaMentalHealth.com.
Are you on LinkedIn if anybody wants to tap in?
Absolutely.
All right, you guys can also check out Mr. Michael on LinkedIn. I'm Efrain with the Hard Hustle Podcast. We'll catch you guys on the next one.
All right.
Laters.